Today, Michigan is taking a huge step in the fight against COVID-19 as coronavirus cases continue to spike in our state. Starting today, all Michiganders 16 and up are eligible for the vaccine. On Saturday, more than 8,000 cases of COVID-19 were reported in our state. This morning, we are being joined by Chief Health Editor Dr. Partha Nandi, up early for us. Good morning, Doctor.
Morning, Brian. How you doing?
I'm doing okay, thank you. Hope you are as well. First, let's talk about the spike in cases. As we just said, more than 8,000 cases on Saturday alone. Do we have any idea why this is happening?
Yeah, Brian, it's really concerning, but it looks like it's really this time from kids, and what's happening is that kids are making up the bulk of this stuff. It's kids less than 10 years of age, right, are up 230%. Kids from 10 to 19 years of age are up 227%. And I think a lot of this is getting all the activities. This after February 8th, I think youth sports programs were reinstated, and sometimes you were not getting mandatory testing available then. So all that's really caused some of the surge. What also happens is that when you have high school sports or events, then you go afterwards and celebrate, and people often don't take precautions. And I think that's what we're faced with now, with the consequences of those actions at this time. So it's a little concerning to see how things are going to pan out in the next few weeks.
And we got ahead of this thing early when we were hit so hard, and then I know we did have some low numbers as well, and now it makes it easier for us to bump up when that happens. And there's not as many people with immunity because of that. As for the vaccine expansion, Doctor, how much will this help? We've already heard that the plan from Michigan leaders is to not impose more restrictions, but to encourage vaccinations, right?
I think it's huge, right? I mean, I think that, again, vaccination. If you can get it now, and then now that it's expanded, you really don't have any reason not to. So as many people as we can get, as you talked about, that herd immunity, I think it'll be really, really critical. And I think that along with that, for anybody who's not vaccinated, or for people like me who are vaccinated, have those precautions. It's not over yet, because there are folks out there who are not vaccinated, and if you give them an infection, this is what's going to continue to have these infections go out of control. And so once we get more people on, as I've said before, if we get herd immunity, then we can go back to normalcy. Then we don't have to worry about, hey, you got a high school sports program that's reinstated, and that's causing increase in infection. So as more people we get on under the umbrella of a vaccination, I think we can do better. But don't forget all of the precautions that got us here.
Yeah, last week, Pfizer said its vaccine is still effective after 6 months. Do we think that will go beyond 6 months, or will we need to get something along the lines of a booster shot? And if you had COVID, how long did those antibodies last?
Yeah, it's a good question. So I was really encouraged by the fact that it was 6 months down the road, because we had data before that only showed it for about 3 months afterwards. So now it's 6 months. So I envision that we may need a booster shot at some point. We need more data to suggest that, but I think it'll eventually be that you have to take another shot. But I think this is a great shot, a shot in the arm. I think that metaphorically speaking, and for people like me who are looking at patients, I think it's great that this extends. I also think that natural immunity, can last several months. People don't exactly know how much. At least 90 days, you think, but it doesn't mean that you stop vaccination. If you've had the infection, you should still get vaccination. That's the key.
That is the key. We still need more data. Dr. Nandi, thank you. Appreciate your time.
My pleasure. Have a good day.
All right.